think one of the key things is that ageing is a global issue. Often we think that ageing is something that is relevant for Europe, for North America, for Japan, but in fact some of the fastest ageing is occurring particularly in middle income countries like China, Iran, Vietnam, Chile. And so there's that global context we need to be considering, and also that the issues in each of those countries are going to be very different. And so what we need to be looking at is how we take account of the diversity of that experience. But we also need to consider the diversity that's inherent in older people as well. That you can have a fit 85-year-old who still wants to work, and you can have a 60-year-old who's really frail and unable to do the things that they want to each day. And somehow, as we develop policy that's relevant to ageing, we need to address the needs of both of those. And I think an example which I didn't give in my talk, but which really brings it home is, there's some people who've worked all their lives in really hard jobs, and in their early 60s are really starting to get to the stage where they just can't continue. If you're going to have a policy on pensions, it needs to be able to cater to their needs, as well as a highly educated person who isn't in a physically demanding job and who can continue to support themselves for a long period of time. So somehow we need to develop policies that are flexible and take account of that diversity. I'm John Beard. I'm the Director of the Department of Ageing and Life Course with the World Health Organization in Geneva. WHO is a very big organisation. We've got 194 member states. We've got a whole range of departments working in very diverse areas, and we're taking a whole of organisation approach to ageing, so that departments working on vaccine development, for example, will be considering ageing issues as they move forward. But in our department itself, what we're trying to do is be a stimulus for action that is evidence-based. So we're trying to strengthen the evidence base, and we're trying to strengthen the links between the people who make evidence and the decision makers who might use it. And underpinning all of that, what we're trying to do is change the way that people think about ageing. So until now, a lot of the decisions that have been made have been based on stereotypes that are really outdated, and they're leading to bad decisions. And so what we want to do is change the way people look at the whole topic. I think the biggest underlying challenge is ageist stereotypes. So a vision of ageing as being older people in the way we thought of them in the middle of the 20th century. An old couple on a porch rocking backwards and forwards. In fact, ageing is so much more diverse than that, and it's so much more, it's changing day by day, and it's impossible for us to know now what it will be like to be an older person, like an 80-year-old in 20 years' time. So somehow we need to be, if we're going to cater for the needs of an older person in the middle of the 21st century, we somehow have to stop thinking about what it was like in the 20th century and start thinking in a much more flexible way about their needs and the ways we might be able to meet them. The biggest study we're involved in is a study called the Study on Adult Health and Ageing, SAGE. It's a longitudinal study which is being conducted in 6 countries, financed by the National Institutes of Health, National Institute of Ageing. We're following 45,000 older people in China, India, South Africa, Ghana, Mexico and the Russian Federation, and each of them have an extensive interview of maybe 2 hours along with their family, and there's some biometric measures such as blood pressure, maybe grip strength, things like that, and also a blood spot is taken. We've completed the first wave in all of those countries, and we're now just starting the second wave, and a third wave will occur in another 2 years. For the first time, it's going to really help us come to grips with what it means to be an older person in a low and middle income country. And it's not the same as in a high income country. And not only what their needs are, but also how well those needs are being met, what the gaps are, and also perhaps what the future will hold. So I think it's the most important research which we're doing today. I often have young people coming to me and saying, should I start thinking about ageing issues? And I think, again, there's this stereotype that ageing is a boring topic because it's this idea of older people on the porch rocking backwards and forwards. This is such an incredibly exciting field. There are so many dimensions to it, so many new ideas coming, and so big gaps in our knowledge that the opportunities for researchers are just enormous. But to actually seize those opportunities, they too need to break down those ageist stereotypes, and they need to understand the different sort of world we're living in and the different needs and the different trends that are occurring all around us.